Welcome back. You're watching Talk with Audrey. Well, it's that time of the year again. If you have a Medicare health or prescription drug plan, it's open enrollment time. It's a very important time if you want to make changes to your 2020 plan. With the details, Dr. Cara James, the Director of the Office of Minority Health at the Centers for Medicare and Medicaid Services. Welcome.
Thank you so much for having me, Audrey.
When does Medicare open enrollment end?
So that's great. Enrollment is open now and ends on December 7th. And so we may seem like a long way away, but we are encouraging all of our Medicare beneficiaries to take a moment and review their plan and see if they want to keep it or make a change for the coming year.
And what do Medicare beneficiaries need to do during open enrollment?
So during open enrollment, it's a great time to think about the changes that may have occurred in their life in the past year. So they may have added a new prescription, they may have changed their provider, or other changes to their plan may have occurred. And it's an opportunity for them to go to medicare.gov and to look at the Plan Finder tool to see what options are available to them. I think one of the things that they'll be pleased to note is that premiums have gone down by 28% nationally on average, so there may be cheaper options available that cover additional services they may need.
Who can participate in open enrollment?
Sure. So open enrollment right now is available to all of our Medicare beneficiaries. So those are individuals who are generally 65 years or older. It is also available to some individuals who have disabilities and are younger than 65. But if you have a Part D prescription drug plan, or if you're on Medicare Advantage, or even if you have original Medicare, you can go to medicare.gov and see what's available for you in your local area.
What is a Medicare Advantage plan, and why should someone consider a Medicare Advantage plan?
Sure. So Medicare Advantage plans offer a variety of services and benefits, some of which may not be available through original Medicare. For example, some plans offer vision and dental coverage. Additionally, beginning last year, Medicare Advantage plans began offering supplemental benefits such as transportation or in-home meal deliveries that can help our seniors be able to age in place and live at home longer. So these things are available through a number of plans, and again, by visiting medicare.gov or going to the Plan Finder tool on medicare.gov, they can see what's available to them.
What if you're satisfied with your current plan and want to keep it?
So that's a great question. If you are satisfied with your plan, you will continue to be re-enrolled in that plan. You don't necessarily have to do anything, but again, there may be something out there that may be even better than what you have. Or if you want to make a change to go back to original Medicare, or if you have original Medicare and want to pick a Medicare Advantage plan, all of those are things that you can do, but we do encourage our beneficiaries to do that before the December 7th deadline.
And what sorts of resources will be found online?
Sure. So there are a number of resources available on medicare.gov. The primary one is our Plan Finder tool. So this allows individuals, if they log on and they're looking, for example, for a prescription drug plan, if they log on to the Plan Finder, it'll automatically populate with the prescriptions that they've had in the past year so that they can see tailored options of which plans would be right for them given their current medications. They also can compare the Medicare Advantage plans, as we mentioned, and sort them by cost, as well as plans that offer those supplemental benefits in their area. And there also is a resource to find local help. If the individuals would prefer to sit down with someone like our SHIP counselors, that's available through the medicare.gov website. And we also have the call center at 1-800-MEDICARE that's available to answer questions.
Where can people go to get local help in their own community?
Sure. So the SHIP counselors, our state health insurance program counselors, are available through medicare.gov. You can put in your local information and find the contact information for the SHIP counselors in your area, or they can call the call center at 1-800-MEDICARE, and they can also connect them with those SHIP counselors in their area and make an appointment to sit down and talk to them. But again, we're encouraging everyone to do this before the December 7th deadline.
And Cara, what happens if people miss the deadline?
Well, Audrey, I'm sure nobody is going to miss that deadline of December 7th, but if that does happen, and individuals have a Medicare Advantage plan currently, they can have a little bit more time up until March to make a selection. However, we would really hope that people don't miss that December 7th deadline and that they would make those choices today. And particularly if they're interested in making an appointment with the SHIP counselor, they definitely don't want to wait until December 7th, as we can imagine those individuals will be really busy at the deadline.
So remember everyone, even if you're happy with your current Medicare coverage, comparing plans could be more beneficial. Why? Because every year, Medicare health plans change in cost, coverage, and participating providers. You just might find something that better fits your needs, or you may be able to save on some prescriptions and other costs. So tell a friend. My guest has been Dr. Cara James, Director of the Office of Minority Health at the Centers for Medicare and Medicaid Services. Thank you so much for joining me.
Thank you so much for having me, Audrey.
And I'll be right back after this.